the topic of this year's EAN meeting is big data. And when we talk about big data, then we immediately realize that we need help in order to deal with the volume of data that different fields are generating. And artificial intelligence is, of course, something that everyone talks about at the moment. When we hear almost on a daily basis people talking about ChatGPT, and that's just one form of artificial intelligence. Now, in the field of protein science, we've had a challenge for decades, and that's to understand the basic rules that govern how proteins fold into their normal three-dimensional structure. And we know this is very important because the structure, the shape of the protein defines the function it performs in a cell. Now, in many neurodegenerative diseases and also in other neurological diseases, we know that either through mutations or environmental factors, proteins change their three-dimensional shape and may end up forming aggregates that accumulate in the brains of patients. So we introduce another level of complexity here. And artificial intelligence is helping us predict the normal three-dimensional structure of proteins, which is very important so that we can then design molecules and therapeutic strategies that can interfere with the proper and normal folding of proteins, preventing the misfolding and the accumulation of aggregates. And so this is where I think artificial intelligence can play a big role in the context of neurological diseases, and hopefully by enabling us to predict and to understand this process of folding and misfolding and aggregation of proteins, we might have a better chance of tackling these diseases by interfering with this very basic and fundamental issue of protein folding.